One of the things of my job, yes, I know it's early. It's like 4:40, 4:47. I've been up all night. If real men can't sleep, real men do the news. And I started off writing for one thing, and it ended up turning into something else. Um, one of I often say that my job is context. My job is pointing out the machinations, the political thought behind the things that take place that news may not necessarily entirely explore, and that go beyond and bring up conversations that news don't even, for the most part, see or is not even on their radar. And I want to point out in this context, for example, Jen Psaki. In my pastime, I've grown fond of watching Jen Psaki basically twirl and school a bunch of toddlers in the way that she basically dazzles them with the answers to her questions. I'll get right back to you, and I'll circle right back around to you. It's like West Wing. But there's some questions that should be asked. And in all of these press briefings, there's at least one question that should be asked that often never gets touched. And on this one, I'm gonna point this out. When I initially watched this, it didn't ring a bell. And then Brazil Wire pointed something out that is monstrous, actually, when you think about it, or potential implications of it. And I'm going to share that with you. Jen Psaki has asked the question on Brazil, basically saying, look, you guys have a huge amount of AstraZeneca stockpiled. Shouldn't you give that or sell that or do something with that for the nations that actually need it? Now, she keeps getting asked this over and over again, and so she has basically a canned response. Now, I don't necessarily have an issue with her response. Her answer is what any country would say, regardless of how left-wing that country is going to be. If that government is going to try to give anything out before everybody on that country has vaccinated and their dog, and potentially on the country, their pet parrot, before giving out to any other country, regardless of what they say, meaning regardless of the devices that they create, they say, hey, we're going to have this organization that's going to do this, this, and this. All of that, I would wager to you, is contingent upon their home populations being taken care of first. Because if they're not, they're going to be politically attacked in their political system, especially if it's adversarial, for doing that. So they're not going to do that. They have no reason to do that other than the political pressure of morality and ethics and some of these other governments that are going to be like, hey, is it fair that you guys are going to keep the resources like that? Is it fair that the resources are partitioned in the way that they currently are? And why would COVID be different? It's not. In fact, it'll be that much more tribal. Not to mention we don't have shared resources, meaning the world is not world heritage. We don't look at it as we have no claim to the world. Any claim is taken basically by, sword, blood, killing, etc. And might makes right. And for whatever we have under the context of that edict, that's what we have. The resources are not going to be partitioned in this way. So you're never going to get a president or a prime minister to basically say, yes, I'm going to give away what we need right now in this moment and what we need to be certain that we have going forward to another foreign country. And those devices that they're going to put there are going to be showboats, at least up until the point where the home countries are full. So again, don't entirely have an issue with that answer. This answer, however, has a huge contradiction in it that has just been exploited by Brazil Wire. I'm going to show you what Jen Psaki said. I'm going to show you what it was related to. Is basically, I just said the AstraZeneca stockpiles. I'm going to show you what's wrong with this statement. And I'll let you judge. Like I said, my job is context. Welcome. Early morning soapbox. My name is Jamarl Thomas. This is Progressive Soapbox. Guys, if you dig this content, please like, share, and subscribe. You can always support this content through PayPal or Patreon. This content is brought to you by you, and I appreciate you the opportunity for allowing me to do it. Or I appreciate you allowing me the opportunity to do it. I always screw that up. For purview, Jen Psaki. take a look at this question. And I want to add in something after you hear this question. Let's
back to the vaccine. I know you say the goal is to vaccinate Americans first, but I want to go back to the AstraZeneca supply sitting here in the U.S. without approval. Many countries are seeking. Brazil is also seeking access to the supply. Brazil is in urgent need. Scientists around the world are saying that Brazil is a threat to the world right now, the situation there, the crisis there. Dr. Fauci said last week that the most important thing to do in Brazil is to get more people vaccinated as soon as possible. But Brazil is struggling. So when can we expect that these countries that need it right now and can use right now because they have the approval there, when can we expect they can have access to maybe this supply, maybe in June or July? Can you?
Well, we are engaged with a range of countries. I'm certain with Brazil as well about their requests. And we are, of course, focused. The president is focused on ensuring that all Americans, all adult Americans are vaccinated. That's the first objective here. But we are looking forward to being, players in the global community's effort to address the global pandemic. There was a significant announcement made on Friday coming out of the Quad Summit about supply that we have agreed to work with the Quad members to provide to a range of countries and regions. And we are certainly open to discussing and considering, when we can provide additional supply. But I don't have anything to preview for you, predict in terms of the timeline.
Now, Jen Psaki and the other cat, Nate Price. Apparently the job is not to give a straight answer. The straight answer would have been, we have to make sure that we have enough to make sure each and every American has enough 2 times over and that our dogs are vaccinated before we give it to you. I know that sounds brutal, but it is true. Otherwise, we will be voted out of office by the opposition and we will be attacked remorselessly. All right, no issue with that. But then you add in something else. Health and Human Services puts out a report. And it's the 2020 yearly report. The government just released the yearly Health and Human Services report. Now, Brazil Wire pointed out that on page 48, immortalized for the duration of the existence of this country, of this government, of this country, under the heading, Strengthening Health Cooperation and U.S. Humanitarian Leadership, under subheading, Combating Malign Influence in Americas, it triumphantly says, the OGA, which is the Health and Human Services Office of Government Affairs, or Global Affairs, used diplomatic relations in the American region. Oh, you can see it right here. This is the actual document, actually. The OGA used diplomatic relations in the Americas region to mitigate efforts by states, including Cuba, Venezuela, and Russia, who are working to increase their influence in the region to detriment of U.S. safety and security. The OGA coordinated with other governmental agencies to strengthen diplomatic ties and other technical and humanitarian assistance to dissuade countries in the region from accepting aid from all of these ill-intentioned actors or ill-intentioned states. Examples include the OGA's health attaché office to persuade Brazil to reject the Russian COVID-19 vaccine, or for that matter, CDC technical assistance in lieu of Panama accepting Cuban doctors. Now, these countries are clearly in dire need of help. They're in help. They need help. And just so we're very clear, that the highest priority of this health organization that's grappling with a deadly virus ravaging the home and domestic front is first and foremost to ensure that U.S. foreign policy objectives are attended to. And beyond that, okay, then we can help you. Linger there for a moment. As a human being, that's even in and of itself a little weird. From their standpoint, stopping any notion of a political win, first and foremost, that was the priority. And if Russia can make a vaccine, they can make it fast, they can make it work, they can make it cost efficient, meaning it's less expensive than one of the other ones. It doesn't necessarily require cold storage. They just dispense it out to their population. That's considered a win. And that in and of itself is problematic. Well, they don't like that. So because they don't like that, their job is to try to undermine and to mitigate Russia dispensing those things from a purely foreign policy text or standpoint, as if these are competing states and everything else, meaning this health organization seems to not care that the vaccines are needed, that the Cuban doctors are needed, and that the United States foreign policy concerns should trump their real physical matter reality concerns of their people in those countries. That's astonishing. Think about that for the moment. That's astonishing. Russian vaccine is cheaper. It's available. We're trying to give you this. And they're saying, you shouldn't accept that vaccine. You shouldn't take it. You shouldn't accept it at all. You shouldn't do it. And with the relationship that Donald Trump had with Brazil, does that deal with the notion that Brazil turned away Chinese vaccines? And you have this situation now where the U.S. is like, don't use and accept these other vaccines. Brazil is drowning in people dying at this moment. I mean, for fuck's sake, this is in their documents. This is something they're trumpeting as, this is what we did. Foreign policy concerns trumps the real material, physical matter reality, human beings that are there dying as a result of the things that we're doing. The Brazilian, right here, let's flip to this for the moment. The Brazilian health minister, Eduardo Pazuello, they're talking about he's going to be sacked. So when he started, he had 15,000 deaths 10 months ago. Today, there are 260,000 Brazilian deaths. Now, he made the point that, look, Bolsonaro is in charge. Bolsonaro is in charge. This is his ministry. He's going to be the one who runs it. So when there was an opportunity for a Chinese vaccine, they said, nope, we're not going to take it. We're not going to take it. That's not what we're going to do. They have that many deaths. They're looking at 500 or 600,000 deaths in Brazil. This is the second worst case in the world, second to the United States. So the point I'm trying to make here is this is where Brazil is. This is where Brazil is. And our health and human services went out and say, don't do things that will be to the benefit of your community because it's to the detriment of our foreign policy concerns. That's astonishing. That's astonishing. And nobody cared. Nobody cared. Nobody at that press conference cared except for this woman. If I may be so bold, what I would ask is that we tweak the question a little bit. And just to come back to the main point. Why did the United States Health Department adopt a policy to push countries that were in dire need of medical help and vaccines to avoid procuring that same medical help and those same vaccines just because the United States didn't like those countries, such as Russia and Cuba? Does Russia and Cuba being on the United States naughty list affect the medicinal efficacy of life-saving treatments? That should be known. Why not? Why shouldn't that be known? Why does it matter that the United States doesn't like these countries if these countries are going to have life-saving medicinal benefits? Are you serious? Everything is just chessboard. That's all it is. And even issues of health, like where people are literally dying as a result of the actions that are being taken. How can the government justify a policy like this? In one breath, we're pushing countries to ignore their own real health needs for the sake of U.S. foreign policy, while simultaneously, meaning the clip that I just showed you, we want them to not get help from these places. While simultaneously, like the woman was asking, storing surplus vaccines that are needed in Brazil and those other countries that you told not to get help from countries that you didn't like. How do you justify that? That's the question. Because that brings in the storage of the supplies, surplus. But it also brings the storage of the surplus. Jesus Christ, I can't speak it this early. Of the surplus in context of U.S. foreign policy going forward, meaning Yes, we told you not to get help. However, we're not going to give you help either in this way. I like that. The contradiction. And if she lets you get one more in, if she's stunned, she's like, who the fuck let this person in? She may even say that. She may even drop an F-bomb. Who the fuck let this person in? Why? Oh, she's asking me a question. What's happening? Now, then say immediately, has there been any study, research, or governmental estimates on the number of people that have been killed from the policy in Brazil and around the world? Meaning, if you're telling people and your allies don't accept help when you really actually need that help, how many people have died as a result of that policy? And shouldn't you know that going forward in order to make a decision, even if you decide to go forward on a decision that killed X number of people around the world because of a policy of saying, don't accept that level of help when you need that level of help. That's astonishing. She'd probably be like, I'll circle back around to it. I'll twirl back around to it. Those are dark questions, but those should be asked. Why shouldn't they be asked? I mean, this is our policy, right? Shouldn't the American public know the foreign policy, especially if you're going to be brave enough to put it and stamp it into a document as if this was a triumphant affair? What she probably says is, well, that was the Trump administration. That was former Secretary Alizar. So we don't have anything to do with that. The thing is, the continuity of the United States is enshrined regardless. And on some level, the policies that Trump put in, Biden is accepting a lot of those. So you can't even make the point of just saying these things are separate and distinct, because they are not. I'm going to end this here. I know it's early, but I was wide awake. So I'm going to say like, I'm going to say share, and I'm going to say subscribe. Thanks all.